Speaking at a press briefing, Director General of the Communicable Disease Control Department of the Ministry of Health, Dr. Ratnasai Petsuwan, said that based on developments in other countries, Omicron infections in Laos are likely to peak in the next 1 to 2 months. The National Task Force for COVID-19 Prevention and Control is urging members of the public to take steps to protect themselves against the virus after lab workers found that 9 of 10 samples that were randomly checked for COVID in Vientiane tested positive for the Omicron variant.
การติดเชื้อของพยาธิโควิด -19 อยู่ในโลก
Speaking at a press briefing, Director General of the Communicable Disease Control Department of the Ministry of Health, Dr. Ratnasai Petsuwan, says last week that based on developments in other countries, Omicron infections in Laos are likely to peak in the next 1 to 2 months. He said, given this prediction, if we do not have strict measures in place to respond to an outbreak of Omicron, even though the death rate is low compared to the Delta variant, we will see deaths among people aged over 60 and people who have a chronic disease, and those who are unvaccinated or not fully vaccinated. Don't forget that no one is safe if someone is unsafe, and that vaccination is the most effective way to prevent serious illness and death, he said. Dr. Ratnasai advised everyone use an antigen rapid test kit to report a positive result on the link in the screen. After the results have been registered, a local COVID task force unit will contact infected people to give them advice and monitor their symptoms. If problems are encountered when using the link, number 163 and 164 may be used to report test results. Laos is now facing another surge in COVID infections. The number of new cases being reported in Vientiane is of particular concern, with figures now rising after being at less than 200 new cases each day for almost 1 month. Dr. Ratnasai urged everyone to take precautions and protect themselves and others by wearing a face mask, staying at least 1 meter apart from other people, and using hand sanitizer or 90% of alcohol solutions to cleanse hands regularly. No one is safe if everyone is unsafe. 80% of the population must be vaccinated to create herd immunity and reduce the number of new infections and deaths. On March 15th, a total of 722 new COVID infections were reported, of which 692 infections were locally transmitted. A total number of 147,409 COVID cases have been recorded countrywide to date, resulting in 643 deaths. Director General of the Communicable Disease Control Department of the Ministry of Health, Dr. Ratnasai Petsuwan, disclosed that no one is safe if everyone is unsafe.